you have to do is go to our Studio 10 page on Facebook. If you're not our friend already, hit the like button. And if we've got time left at the end of the show, we will read a few more of those comments for you. Guys.
Thanks, Michael. Speaking of the new year, getting healthy is a great resolution for the new year, but a big part of that is taking better care of your heart. Today, we're going to talk about what's new in heart health. Joining us this morning, we have Dr. Jason Cole with Cardiology Associates at Springhill Medical Center. Thank you so much for joining us.
My pleasure.
All right, now, what are the most important preventative heart health measures that all of us can take in the new year?
Well, I think it's important to remember that heart disease is still the #1 killer of Americans, really, both men and women, and many of the issues with heart health are under control. The risk factors for heart disease are sedentary lifestyle, obesity, and cigarette smoking, all of which are clearly modifiable. High blood pressure, diabetes, family history are other important aspects. So I think focusing at a new year, there's never a better time to stop smoking.
Right.
Exercise, living right, those are important, but also paying attention, taking that trip to the doctor, asking your doctor what are some of the new ways that we have to evaluate for risk. Those are all important things, and January is a great time to do that.
Now, speaking of, there are some new screening methods. Can you tell us about some of those?
Sure. I think that most people are aware of routine stress tests and blood pressure checks and routine cholesterol, but that's not really the sum total of how we look at people now. It's important to talk to your doctor. We have lots of new ways of testing people. We don't just check routine good and bad cholesterol anymore. We look at a profile breakdown. We look at types of cholesterol. We have non-invasive screening tests where we look at the neck arteries for early plaque. We do a test called coronary calcium scoring, where we do low radiation CT scanning of the heart that show early plaque that no other test is going to show. So I think those are really important things to understand. Who are the people who that's important for? Well, really, obviously, anybody it's important for their health. Right. But I really pay attention to those people with strong family histories. If you have a strong family history, which generally would mean men in their 40s, women in their 50s having heart disease, any siblings having heart disease, now's the time for you to do things proactively about your health.
Is it usually when you guys ask, when doctors ask about your health and what runs in your family, is it usually we should think about our siblings, mother, father, grandparents, or does it branch out? I
mean, obviously all of those things are important. From a cardiac standpoint, again, cardiac disease is the #1 killer in the U.S. So there's going to be almost nobody who doesn't have some level of coronary disease in their family. By coronary disease, we mean heart attacks, stents, bypass, things like that. But we really pay attention to those first-degree relatives. So if your siblings or your parents or maybe even your grandparents at a young age had disease, those are people we really want to focus in on.
Now, it seems these days people are living a little bit longer, even when they have the cardiac, anything to do with the heart. Why is that? Are there new treatments?
Well, a lot of it has to do with new treatments that we have available. For example, statin therapy, which is a treatment for cholesterol, is something that's really only come in about the last 20 years, and it probably is adding 5 to 6 years of life to the average person. Aspirin a day decreases your heart attack risk by 30%. There are very simple, cheap things that your physician can do that make a huge impact, and it's just important to be proactive. But if we don't know that you've got disease, we can't do those things, and that's why early screening is an important thing to do.
All right, very good advice. Thank you so much for joining us. Really appreciate that. Up next, we're heading back into the kitchen. Deanna's hard at